Let's now go back to Malawi, where that country has become the latest African country to record cases of the coronavirus. We've asked Malawian journalist Daniel Mababa to join us now via Skype for the latest from that country. Daniel, before we got cut off, you were just taking us through whether the 3 confirmed cases of coronavirus in Malawi were just local transmissions or the patients had travel histories.
Thank you once again. The initial patient had recently traveled to India. She had just returned some 3 weeks ago to Malawi. It is believed that while in India, where she was with her husband, she was in contact with someone, a relation, who later tested positive for coronavirus. And when the couple returned to Malawi, they went for their tests that initially turned negative. But when they were ordered to undergo a second test is when they confirmed that they had the coronavirus. And the lady initially transmitted it to, it is believed, she transmitted it to one of the other relations and a wife to their house worker.
Now, we understand that 20 people per day can be tested for the virus, and there are about 25 intensive care unit beds available in that country, with only 7 ventilators in a country of about 18 million people. This certainly does not paint a clearer picture of a country ready to deal with coronavirus containment.
Quite correct. I had just gone around the initial or the first isolation center that the government and the other development partners, particularly the USAID, UNICEF, are trying to set up in Lilongwe, where we have these 3 cases. That center is not ready. I found beds outside. They're trying to still fix the beds, the dormitories for the doctors that will be working there. They are still not yet set up. And that has really raised a serious concern among health workers, among the citizens. On the streets, the authorities are still trying to clear. We still have a problem of street vending in Lilongwe, and the situation still remains. The city council is trying to move vendors away, but it doesn't seem to work. And just this evening, as we were following the updates, we are hearing from the Medical Doctors Society of Malawi that are now demanding that all the first 100 cases that were tested and came out negative be retested. They doubt the initial results that came out negative as being true.
I mean, before the news broke of infections in Malawi, it was just business as usual. It's just mentioned that people were still going on their business, being vendors, and we've seen mass gatherings at places like the markets. But now that the news has struck that coronavirus is indeed in Malawi, do you think people's attitudes have changed?
Quite completely. I think there's a great level of change in people's attitude. Like I indicated, right here in the capital, Lilongwe, where I'm in, the city council has been trying to move away street vendors for the last 5 days. That was not working. But a day after the confirmation, just hours after the confirmation of the first 3 cases, we saw the vendors obliging. That clearly goes to explain how people are so willing to abide, or are so willing to accept the rules that have been set aside by the government and the city council to ensure that there is no to ensure that the virus is contained within Lilongwe. There are already fears that there's a lot of traveling that happens between Lilongwe and Blantyre, our commercial capital. There are already those fears that the easiest place to be transmitted to is Blantyre, and there have been those calls as well as I speak now for authorities to maybe lock down the city of Lilongwe. I don't see that happening anytime soon, but the president will be making fresh restriction orders, he says, in a brief that is expected anytime soon.
Apart from a multi-million-dollar preparedness plan that the government has set in place, what are other precautions that the government has taken? Well, in terms of restricting people's movement, in terms of international flights, for instance?
Well, from the 1st of April, there are no flights. All flights have been cancelled. Our airports are closed, except for emergency flights, ferrying drugs, for example, and anything of that sort. From the 1st of April, the government has issued a directive to reduce numbers that can be on a commuter bus, for example. From 5 days ago, the government has restricted public gatherings to no more than 100 people. So those are some of the measures that the government has put in place, and they seem to be working. Those traveling by commuter buses have testified of abiding by the restriction of reducing the numbers. So those are some of the measures that seem to be working on the ground.
You know, Daniel, we know that Malawi has plenty of experience of containing contagious diseases in the past. But then Oxfam has come out to state that it is barely prepared for a disease that can spread so fast. So what are the chances of this disease spreading, in particularly in the densely populated communities?
Really, if you ask me now, people are afraid. People are afraid on the streets because we could get the sense that it was easy to prevent the virus from getting into Malawi than containing it once it's confirmed, like is the case now. We have slums just a few kilometers in under, say, 10 kilometers from the main city centers, slums, hugely populated areas. And I think that's what brings in the fear among people. Our economy is a hand-to-mouth economy. Maybe over 80% of people in this city, Lilongwe, live on hand-to-mouth, over 70–80%. And that brings in the whole idea of whether containing the virus is something that can happen as quickly as possible. That remains to be seen. But like I have said, a healthcare system in a shambles, and then given the city council failing to manage crowds that throng the city every day, really with those factors, it would be difficult to really contain the virus now.
Well, just before I let you go, Daniel, interestingly, former President Joyce Banda has accused the government of hiding the real figures. Is she right, from what you've gathered?
Well, I think that's a difficult one, really, because initially when the government said there was no case, people said, no, the government is hiding something. And interestingly, Joyce Banda spoke like a day before President Mutharika came out to confirm the cases. It's as if she knew something about it. Well, she's former head of state. She may have been privileged to some intelligence. I mean, I don't know. That I may not know. I may not say it now. But to say the government is hiding cases or is hiding things, I do not think that's entirely right. I think the government has been doing all it can. Of course, we have gaps and shortfalls, glaring ones for that matter, in information management in terms of dissemination of information on this COVID-19 issue. But I think the government has been trying all it can. We had issues to try and confirm the 3 cases before the president had made the announcement. Like all channels of information were literally blocked or closed. It's like everyone was waiting for the president to make the announcement, but that they are hiding cases, I may not entirely agree. Suffice to say, I would agree with what the doctors are saying now, that we may need to retest the first 100 cases, for example, because mind you, like I said in the first place, these 3 cases that have been confirmed initially came out negative. So there are those fears that that could be the case with the rest of the other tests that were conducted initially, and they were over in total, according to the Doctors Society of Malawi.
Malawi journalist Daniel Mababa joining us live via Skype. Thanks for your time. Much appreciated.